Okay, so a few of you guys have asked me to help you to remember how to differentiate between some of the different neuro diseases that we have discussed in this class. So I'm going to graph out just a few of the basic fundamental pathophysiology facts about some of the diseases. Now, for the purpose of this exercise, we are not going to get as in-depth as we do in lecture. We're just going to talk about some of the key features of a few diseases. So let's start with the only disease that affects the peripheral nervous system, and this is Guillain-Barré, and we'll abbreviate this GB. So Guillain-Barré, when you think about that, remember this is a disease associated with ascending paralysis. So with Guillain-Barré, the paralysis is ascending, so starts at the toes and goes up, and one of the things we really want to be concerned with is as the paralysis ascends, it can affect the diaphragm. Now, some of the etiology to remember with Guillain-Barré is there is a lot of inflammation involved, and that inflammation will destroy the myelin sheath. So the myelin sheath is destroyed or damaged, and that leads to the paralysis and the excruciating pain that the patients feel. Remember, the ascending paralysis is really one of the clinical manifestations. And what we want to be concerned about here is the respiratory failure and cardiovascular system failure too. So all of this contributes to the fact that your patient will probably have to be on intensive ventilatory and cardiovascular support. All of this contributes to the fact that your patient will probably have to be on intensive respiratory and cardiovascular support. And this typically takes a few months to resolve. Another point is that there is an acute onset. So sometimes your patient will be sick and then all of a sudden they will manifest with this ascending paralysis. Sometimes it's after a virus or an immunization or fever. Okay, so the next disease now, we're going to get back into the central nervous system. So the next disease we're going to talk about is multiple sclerosis. So when you're thinking about MS, remember MS is associated with plaques that form on the central nervous system, and by that I mean the brain and spinal cord. Similar to Guillain-Barré, there is a loss of the myelin sheath, but unlike Guillain-Barré, remember this is a central nervous system disorder. So there are 4 main types of multiple sclerosis, but I'm not going to get into the specifics in this video because we're just covering the basics. All right, so due to all the inflammation that you see with multiple sclerosis, your clinical manifestations will vary, and they vary really depending on the location of the damage. But you typically see eye problems. By that I mean blurred vision, sometimes total loss of vision. You see a lot of systemic weakness and extreme fatigue. Another problem that you may see is loss of balance and coordination, which is due to this loss of the myelin sheath and is a huge risk of falls for your patient. Okay, so now let's talk about Alzheimer's disease. We're still talking about the central nervous system here. So Alzheimer's disease is associated with neurofibrillary tangles. And these are little clusters or clumps of tangled up proteins that contribute to the senile plaques that are seen in the tissue of the brain of somebody with Alzheimer's. So both of these, both the tangles and the plaques, contribute to dementia by causing neuron damage. So Alzheimer's is chronic and progressive, and it does get worse after diagnosis. More clinical manifestations that you would see are anxiety and depression, and the anxiety is often coupled with agitation. And then as the disease progresses, you see a lot of problems with judgment, problem solving, and communication. Eventually your patient will need some help with ADLs, and due to many factors, accidents and aspiration pneumonia are really common concerns. Okay, so now let's talk about Parkinson's disease. This is another central nervous system disease, and it is progressive, just like Alzheimer's. With Parkinson's disease, you have a neuron degeneration that occurs. The neural degeneration can be due to an idiopathic unknown cause, but it can be secondary and linked to other causes such as infection, intoxication, or trauma. When you think of Parkinson's, think of dopamine. Now, dopamine is a really important neurotransmitter. With Parkinson's disease, the balance of dopamine is messed up, so you have a dopamine imbalance. And that's what's responsible for the clinical manifestations of Parkinson's. So Parkinson's disease is typically identified at first by a tremor. The patient may also have some rigidity. Their movement is impaired. they have akinesia or bradykinesia. So akinesia is a decrease in voluntary movements, and bradykinesia is slow. And you really can see this when the patient tries to initiate activity. You also will see some cognitive changes as time goes on.